This is an update for Walker Street Doctors for Tuesday the 29th of March 2022. Flu vaccinations have arrived into Australia and the distribution process to general practices around the country has begun. And this is a 3 to 4 week process starting with aged care in rural Australia receiving their deliveries first. We've received our private flu vaccines and are expecting delivery of our funded influenza immunisations this week at some stage. Flu vaccines are government funded for over 65s, under 5s and anyone with a chronic illness. This year will be a little bit different from years gone by. In the past, most of our consultations were face-to-face and we opportunistically vaccinated our patients while they were here. For the 2022 flu season, we'll be running dedicated vaccination clinics on Tuesday and Wednesday afternoons from 1 p.m. till 5 p.m, starting from next week on Tuesday the 5th of April. These vaccine clinics will be run by Dr. Alice Killen, AM, who's very kindly giving us her time to help our practice with vaccination, and also it'll be run by the very able and delightful practice nurse Chelsea Sharping-Chan. From the 4th of April, ATAGI has now also approved a winter COVID booster for the general population aged over 65, for Aboriginal and Torres Strait Islander population aged over 50, and for those who meet the ATAGI guidelines for immunosuppressed, which would actually be their 5th dose. Importantly, this booster should be given 4 months and not less than 3 months after the 3rd dose. And the preference is for an mRNA vaccination, Pfizer or Moderna, for this purpose. Conveniently, influenza immunisation and the winter COVID booster can be given on the same day in different arms. So why have another booster? And why are adults under 65 with chronic health conditions and healthcare workers left out of these new guidelines? It's been an ongoing theme of this pandemic that age is by far the biggest risk factor for poor outcomes. Even more than immunosuppression from illness or medication, the immunosenescence that occurs with ageing is the biggest risk factor of all for severe disease, hospitalisation and death. And keep in mind that the COVID vaccines that we currently have were made to protect against the original parent strain of COVID. And Omicron, BA1 and BA2 strains have significant mutations and immune escape, and the immunity and protection from severe disease that we get from the vaccines have limited duration at present. It appears that the extra benefit of a winter booster for adults aged under 65, even with coexisting conditions and higher exposure risk, is limited, and ATAGI is actively watching this space and will update their advice accordingly if required. We hope that the last 2 years have taught everyone the importance of staying home and isolating when unwell, COVID or not. And we hope that that sort of change will be enduring into the future. Moving forwards, QR code check-in will have limited utility with such a large volume of circulating virus. However, the use of masks has been shown to be extremely important in curbing the transmission of COVID, and they'll continue to be worn indefinitely by patients and all of us at Walker Street Doctors. So please do make sure that your mask is not only adequately covers your nose and mouth, but that it fits well with a good seal and has adequate N95 or P2 filtration capacity before you step foot into the lift into our building, and absolutely before stepping foot into our practice. We also have an expectation that all children over the age of 2 are also wearing a well-fitted mask before entering our practice. We have an obligation to preserve the health of our workforce and our patient base alike. We'll also continue to have telehealth as our default consultation type in order to limit crowding in the practice. Please do email us a photograph before rather than after your consultation, because it may be some considerable time before we can get back to readdress your issue again after the fact. The appropriate email address for photographs is reception@walkerstreetdoctors.com.au, and I hope this update has been helpful.